Contracted HIV and hepatitis C in Chicago after an organ transplant. One woman who contracted the virus said she was not notified that the organ donor was what's called high risk, or had a high-risk lifestyle. Joining us today to tell us how this can happen is the CEO of OneLegacy, one of the largest organ donating agencies in the country. Welcome.
Good morning.
Well, tell me what happens in an organ donor situation. I've had the opportunity to fly with a kidney across the country. I thought the donors are very screened. How can something like this happen?
The donors are extensively screened. There are about 30 different tests that are done on every single donor prior to the organs actually being recovered or even offered for transplant. However, every test that exists has some limitations, and known as in the case of an HIV and HCV hepatitis test, this window period, as it's called, can be up to 16 to 20 days post-infection that it might not be picked up by the standard testing.
And a high-risk donor, what exactly does that mean? Because it seems like a politically correct terminology, because if I understand it, they do an HIV and a hepatitis C, but then they go ahead and say, well, oh, by the way, these tests are negative, but they may actually be positive?
Well, the Centers for Disease Control, the CDC, has identified the terminology of high-risk donor, and in large part it is individuals who are at high risk for potentially transmitting HIV and possibly hepatitis C as well, due to whether it be sexual behaviors or intravenous drug use in particular. And that is something that the organ recovery agencies are charged with trying to capture that information in a medical social history that's done before donation with the family members or loved ones at the time of consent, and then are required to pass on to the transplant center when making the organ offer and providing the organ.
And in this case, the woman suing says she was not notified, so she was not given an opportunity to decide to whether, in this case a kidney, whether to accept the kidney or not. Does it get transmitted from the donor center to the recipient? What happened here?
The sequence of events is the organ recovery agency learns of this information, incorporates it in its medical charts, and also incorporates it in the organ offer, which is electronically made to the transplant center, transplant surgeon, and their staff. The center makes its decision based upon including that information, knowing that there may be a medically high-risk donor circumstance, but also knowing that the risk of not having a transplant is very, very high for that individual who may be desperately awaiting a life-saving transplant.
Right, but
so they balance those risks.
Right, but
and then the transplant center informs the patient.
Right. I think the risk assessment is a little bit different if you need a heart and you're on an artificial pump keeping you alive to accept a high-risk donor versus if you're on dialysis for 6 years like this woman was, and you can take a pass, which she did also. Wouldn't you agree that it really depends on what you need the organ for?
There's no doubt that the more threatening your condition is, like needing a heart for transplant or a status 1 liver, would be you'd be willing to take more risks if you're not expected to survive a week or a month than you might a kidney.
Well, is the government going to get involved in making new rules and making new policies after this unfortunate series of events?
Yes, the CDC and the FDA and the Division of Transplantation of the Department of Health and Human Services, in fact, held a joint phone call this past week in which an assessment of the particular case was done, looking at the opportunity to implement new testing guidelines. There are some fairly newer tests out which may reduce the window period. It'll never remove it, but it may reduce it down to 5 to 7 days instead of 9 to 12 days. So it may save a week, may provide a week's more coverage for potential donors from hepatitis C and HIV.
And what message do you have to people that are on a donor list? Does everyone go back for a 3-month or a 6-month HIV and Hep C? Is that a standard policy, or is that going to be implemented now?
No, it is a standard policy for recipients to receive follow-up testing for a variety of potential disease transmissions, in part because you always want to be cautious, in part because they're on anti-rejection medications which reduce their immune system response. So that's a standard to do that follow-up testing. And it is important to know that while these cases are tragic, that there are some very, very successful transplants of HIV-positive recipients who are doing quite well. So there's a positive role model out there for living with a transplant and HIV. And that these are the first cases in 22 years with between 5,000 and 8,000 organ donors, 20 to 25,000 organ transplants a year over that period of time. And this is the first transmission that's happened in 22 years.
Right, and that's a good point. I think we're going to end on a positive note that this is a very rare occurrence and not the common. And also I want to apologize for not identifying you at the beginning. You're the CEO of OneLegacy, and your name is Thomas Mone, and thank you for joining us today.
My pleasure to be here. Thanks for inviting me.